Welcome to a Tech Moment on Cannabis Tech. I'm your host, Christina Etter. In this podcast, we talk about some of the exciting science and technology that's shaping and impacting the cannabis and hemp industries. Now, last week, we published an article regarding the rise in consumer research, noting that many producers are starting to kind of take initiative on their own account and partner with research facilities to help prove the claims with some qualified scientific studies. So while the naysayers may have always said, we need more research, many companies are literally stepping up to that challenge. Now, as a journalist, there's been multiple milestones in my career that I've always kind of looked on as being significant. And about 3 or 4 years ago, I had an opportunity to interview one of the leading names in cannabis research in the United States. And today, I'm absolutely thrilled to revisit that moment as I welcome Dr. Jeff Chen, the CEO and co-founder of Radicle Science, to the show today.
Thanks for having us.
In addition to Dr. Chen on the show today, we also have Angie Tebbe, who is the CEO and co-founder of Ray, a socially conscious, women-led wellness brand that just announced the addition of CBD supplements to their line. But not only that, they have actually partnered with Dr. Chen's company, Radicle Science, to prove the science behind CBD for health and wellness, particularly for women. Welcome to the show, guys. I'm so excited to have you here today.
Happy to be here.
Angie, I want to dive in real quick with you and start with Ray and talk a little bit about the company, because this is kind of your first step into the hemp and cannabis sector. So tell me a little bit about your motive behind the partnership with Radicle Science, and then tell me a little bit about Ray Wellness prior to the launch of the new supplement line.
Yeah. I think what I'll do is probably start a little bit further back and tell you a little bit about how I got into wellness more broadly, and then I'm happy to go there because it's so important. But 3 years ago, I had a wonderful corporate career, 2 toddlers at home, and a really, really full life. But my well-being was continuing to decrease on the priority list. I had an opportunity to think about what wellness meant to me personally and professionally, and how I could bring that together as my next chapter. And really, I grew up in a really holistic household. My mom was a nurse. My dad was very much into Reiki, homeopathy, and we were the really weird family meditating on the lawn in Fargo, North Dakota. And so, to honor what I knew so well, at that point, I decided to leave my corporate life in pursuit of my own well-being with a very clear why into wellness as my next chapter, personally and professionally. Why that's important is because I know so many women feel the same way I do, or I did, and I still do sometimes today. As I sought, though, during that time frame to take better care of myself through a number of ways, I have always believed in the power of supplementation. And I continued to find one of 2 things. First, for the quality that I believed women deserve, there was nothing in the market for the price point I was willing to pay. It was all really, really expensive. And secondly, those supplements that did exist at the price point that I thought, were attainable and affordable were either not made for women or were chock full of sugar in the gummy format. And so really kind of how the idea behind Ray started was I had this idea to create a holistic, holistic and accessible products that did not exist, but knew that I wanted to do it with scale with the right partners like Target so early in our journey. So really what Ray is a women-led company, and our mission from day one is to stand for well-being of all through pure, powerful, and attainably priced supplements. Wellness should not have to be a full-time job. It should not have to be expensive, and it should truly be for all. And from day one, we wanted to make sure that we welcomed all. And our movement into CBD is no different. And so, being a brand that stands for well-being for all, we take a really holistic approach to how we think about wellness. And what that means is our products, while vegan, non-GMO, no harmful fillers or colorants, gluten-free, etc., they're evidence-based and a blend of both East and West philosophies. And what we do is we provide solution-oriented formats to deliver on helping women feel their best from inside. And what we call them territories, whether that be stress, sex, sleep, skin, digestion, hormones. We saw a need to provide products across those needs and to develop a universe that works together. And really, because so often what we hear from our community is, I'm not sure what it is, but I just don't feel right. It was so important for us to provide products across a spectrum. That was really, really critical from day one. And so our entire universe supports the body and mind through well-researched nutrients, and herbs that have been used for centuries. And while existing studies suggested that cannabis oil had a considerable potential to impact and support wellness, there was a glaring gap in the research dedicated to guiding effective product development. And so you can see where I'm going. To be a company that is about holistic well-being, and doing that in the right way, it was so important to think about CBD from day one, when we started our company. So it was always there in the back of our minds, but we knew that consumers were confused. There's little research, around commercially available CBD. And so from the beginning, we really knew that we wanted to take our time and have a really thoughtful approach about how to bring this to market in the right way, not just products, or content, but with data that didn't exist.
Right. And I think that is so very important because the CBD industry right now is so explosive, and there's so many companies getting into this. Like you said, it's confusing, I think, for consumers to see such a broad array of products and not know what those variances are between one product to the next, or really what they're getting in general. We all know that there's issues with labeling issues, there's issues with testing in CBD. There's just so many different variables that can affect the quality of the product. I think data is the only way, and qualified research is the only way to really be able to, one, make the product safe, and two, be able to have some information behind the claims. So obviously a lot of CBD companies are getting in trouble because they're making health claims. So let's do the research so we know that we can make the health claims. I think that's just kind of the next logical step, right?
Or agreed, and even claims aside, so that we can be sure that what the beliefs are in the industry, is supported and backed by data. Whether that be the supply chain, whether that be broad versus full spectrum. Like, there's a whole host of beliefs that exist out there without a ton of research. And so what we did was we created an in-home longitudinal study, and Radicle was a part of it from the beginning. And so we knew, to your point, like setting up the study and ensuring thoughtful data was everything from the beginning. And we when we started this process, knew it was an investment for Ray, but really our belief system, exactly everything you're saying, is it was an investment for the broader industry to be able to provide one of the largest pieces of research, the first female-only study back to the industry, where the data was lacking. And so we see this as a big step forward, obviously for our company, but more importantly, to inform the future of women's wellness.
So talk to me a little bit then about what that process actually looked like to add CBD to your product line. Were there some challenges or some steps that you had to take to kind of add that ingredient into some of your products?
Yeah. So what we're bringing to market, or what we've brought to market, is two CBD products. So they are broad spectrum, single strain CBD products. And so obviously we think about it as an ingredient, but being that we have these broader territories and these broader products, we really see it as complementary to the products that we already have. So today we haven't taken a product and put CBD into said supplement that we already have. We're thinking about it more as in addition to the broader universe, that can work holistically together.
So Dr. Chen, thank you so much again for taking the time to come on the show and talk about this partnership with Ray. I feel like there's been, a lot of changes since we talked last, and I would love for you to kind of just review with our audience, what have you been doing for the last 3 years, and what kind of led to the creation here of Radicle Science?
Yeah, sure. And so maybe taking a page from Angie's book, I'll back up a second to how I even ended up on this path. So I'm trained as a physician, and actually, when I was in medical school, I was actually training to be a physician executive, and so I was earning my medical degree and my MBA at the same time at UCLA, and I thought I was going to create large scale impact in healthcare by running healthcare systems. And after I graduated from business school and medical school, I quickly realized that healthcare systems were not where the innovation that I wanted to see was going to be created. They were just so regulated, so bureaucratic, so much institutional inertia involved. And and what caught my attention was cannabis and CBD. And the reason is you had tens of millions of Americans using these products without FDA trials. Academia wasn't studying them. Doctors couldn't prescribe them. It wasn't pharmacies dispensing them. Biotech and pharma companies weren't producing them. Yet you had tens of millions of people kind of self-experimenting. You had the companies making the products kind of also self-experimenting as well. And so I thought this was such a fundamentally innovative way of developing products, learning about their health effects, and all of it was happening outside of this insanely bureaucratic, slow system. So I thought this is fascinating. We need to study this better. And at that time, the best way I thought that we could study this was by creating a research center. So I started the UCLA Cannabis Research Initiative and ran that for 3 years. And we were conducting some of the first ever studies on cannabis and CBD products. About 3 years in, and by then we'd had dozens of faculty involved in the program. Across all of our faculty, there had been, double-digit millions of dollars secured from state, federal, and philanthropic grants. However, these studies were still going to take years and years and years to get results. And the worst part is we could not study a single one of the commercially available CBD or cannabis products out there. And that had to do with the fact that UCLA took federal funding and lots of reasons. And so I came to the conclusion that the research and information that I wanted to generate at the speed I wanted to generate and the relevancy to everyone from consumers to doctors to retailers to regulators, it wasn't going to happen in the current system. And it was no fault to UCLA. All the universities are kind of stuck in this conundrum. And so about a year ago is when I left UCLA to start Radicle Science. And I teamed up with my co-founder. Her name is Payleen Thorogood, and she's a tech CEO turned kind of venture philanthropist. And she had been the biggest private funder through her foundation of cannabis and CBD research to about $5+ million of grants that she was giving universities. And she arrived at a similar frustration, which was why can't they study the products that tens of millions of Americans are using? Why did these studies take 5 years to generate results? And so we teamed up to start Radicle Science. And there's a few kind of key pillars that we had to implement in order to do this better, faster, cheaper. So first off, it's okay, we can't take any sort of kind of government funding. Because then it comes with all sorts of restrictions. All right, so we're not going to do that. And also, clinical trials are very expensive because they often have to involve lots and lots of hospitals, doctors' offices, doctors, research staff, all this stuff, data entry personnel. Well, let's eliminate all that physical infrastructure, go completely virtual, and then also let's cut out all the intermediaries involved, automate a lot of it, and go direct to consumer. And so that's kind of how we arrived at this notion of, all right, there's a way to do these studies significantly cheaper, faster, and better. And so if Payleen were here putting on her data technology hat, she'd talk about the fact that it's the diversity and inclusion of these large-scale virtual trials. They're not bound by geography. They're not bound by you having to live in a metropolitan area within driving distance of a large-scale academic research center. So now we can include all sorts of different people. And what we're going to find, what we're already finding, is there's definitely personalized differences um, amongst usage of cannabinoids. And it's not a surprise. It applies across the board. Food, pharma, like all these things. We know there's personalized differences. But when clinical trials cost so much traditionally, and you can only have maybe 300 people in a trial, and when you only have those amount of slots, you're kind of forced to pick very homogenous people to put into them. Excuse me, there's a truck driving by right now. But when you can lower the costs dramatically, then you can have large scale studies and you're not worried about having very homogenous folks. Again, generally clinical trials for pharma have been done on white men living in metropolitan areas. And so we're hoping that that also can be a key innovation. Not only can we discover what cannabis and CBD actually does, but we can also further learn for whom, at what dosage, at what kind of usage instructions does it have those effects.
Right. You know, and it's funny that you mentioned that most of the research in the past has been done with white men. And, you know, a lot of that, I think, has to come from the stereotype of the cannabis consumer, of, you know, that original stigma that the people that are using cannabis are, you know, 20-something men. And as legalization has spread, as the market has grown, we've obviously seen that demographic significantly change. We've seen a lot more older people coming into the industry, and obviously we've seen a lot more women come to the industry to look at cannabis for something other than getting high. That's not their intent. That's not what they're coming here for. And it's a completely different side, I think, to the cannabis industry when you start to look at those demographics versus that first initial demographic that we always used to think about, you know, in the early 2000s and stuff, when the legal market really was just kind of starting to kick off. And I love the fact that data and sales records and all of these things that are happening are proving the fact that women are a growing audience to the benefits of cannabis and hemp, and they are absolutely, I think Angie kind of touched on, wanting to take more accountability for their own health and wanting to approach their healthcare in a different way. And I really believe that eventually we're going to get there. But real quick, before we move into your actual partnership with Ray and the research that you're working on, tell us a little bit first about what it is that Radicle Science offers to producers like Ray and other producers in cannabis and hemp. Are there different levels of research that they can partner with you on, or kind of what exactly does Radicle offer?
Oh, sure. Yeah, I totally kind of blanked on that part. So, Radicle wants to be your turnkey research, science, and data partner. And so you can come to us for a variety of reasons. So if you're trying to develop a product, we can help you compare various different test formulations so that you can better understand what product you actually want to release, right? If you already have a product in market, we can help you understand your existing customers, how they're using your product, what effects they're experiencing, kind of generating this real world data so you can make better business decisions. And all the way to, if you want to one day make a claim that your product was proven to do XYZ, substantiating structure function claim, that's our kind of most rigorous study to substantiate the structure function claim. So in essence, what we're doing is really democratizing access to research and clinical trials for natural health products. And specifically right now, we are completely focused and dedicated to CBD products for the rest of the year. There's a tremendous amount of need. Eventually, starting next year, we'll expand into serving cannabis products where there's also similar amounts of need. And eventually, long term, it's all about the whole world of natural health products, because, what does the future look like where you have objective, personalized data on naturally occurring products? Well, we think that's a world of democratized medicines. These things are inherently accessible, affordable, for all future generations. And that's really what excites us about the long-term mission. And again, traditionally, institutions, pharma, they don't research these things because they can't patent, monopolize, and see this multi-billion-dollar ROI. And only if that ROI is there, if that patent monopoly opportunity is there, will they invest the average $1 billion it takes to get a drug through the FDA. Well, what if this notion of generating data, what if it wasn't $1 billion? What if it wasn't 100 million? What if it wasn't 10 million? What if it wasn't even $1 million? Well, now maybe you can invest in this research and still see ROI, and you don't need to patent and monopolize these products in the same way and charge exorbitant prices that nobody can afford.
Brilliant. Absolutely brilliant. And I love to hear that approach, because I think you're right. I know that that's one of the reasons why a lot of pharmaceuticals are so expensive, and why there's why they have the power that they have, I guess, in terms of lobbying and things like that. And it is because it's incredibly expensive to develop these drugs and things under the FDA rules and the DEA rules and all the things that have to happen, regulation, and I'm just so fascinated. I think the research into cannabis, I think, is something that, we've kind of slowly been lifting that veil on, and more places are starting to do the research, but it's just so encouraging to see these kinds of partnerships happening, like you said, where we're actually testing the products that consumers are consuming. So on to that, let's actually talk about this partnership now. And Angie, feel free to jump in here. Tell me a little bit about, what was the background going into this first study, and how did you decide really to partner with Radicle Science and move into this first round of research for the CBD supplements?
Yeah. The partnership was so strong from the beginning, and so much of what Jeff just discussed is the reason why our thought processes were congruent, our beliefs on, attainability and accessibility and affordability were so congruent. And so immediately we formed this really, really strong bond around what's happening in the industry, and zooming even out from, cannabis supplements into the broader wellness industry. Like, we've always been fighting against wellness being for the 1%. And so it's been so fascinating, and it's so timely, because women are, focused. They're finally putting themselves on the priority list. It's been such a fun journey to see how health and well-being has become such a large focus in daily life for women. And together between, Jeff and Pauline and Radicle and other partners involved, like, we just believe there's such a long runway for companies that are making health and wellness attainable, both from a product perspective, but also from a content, data, information perspective. And so there was no question, in thinking through that they were the right partner. And what is so exciting is finding the right research partner from the beginning allowed us to make sure that we were doing things right. When you conduct a trial with over 1,000 women, and you want to be able to slice that data, understand that data, and really come out with insights for the industry, but also like how to develop and create the best products. That's kind of how it all got started. And so what we're bringing to market, I should mention this, is what we're bringing to the market today, and right now, is this is just the first phase. But we got, as we conducted the trial, we just got so excited about the phase 1 results, because they underscore, the anti-anxiety potential of CBD, which is one of the bigger reasons why, women come into CBD or decide to think about CBD as a supplement. But this is just the first phase of the analysis. So this is what gets us really excited, is when you set up the trial right, you take the right partners. There is so much that's going to be released later this year in a comprehensive white paper with even more exciting data. And so doing it right from the beginning was so important for us if we're going to make the investment. Again, like I've been saying, not just for Ray, but for the broader industry at large, that, mission aligned, values aligned, and making sure that we had complementary things to bring to the table, a product to test, their expertise, and we're continuing to find the research and just find some really, really fascinating results.
Dr. Chen, I want to go back and talk a little bit about the tech that's involved in this research. I noticed on the website at Radicle Science that participants use an app to report data. So do you want to talk a little bit about that app and how it works?
Yeah, sure. So, if you go back to a lot of traditional trials, the way you used to run these was, especially for pharma, and the way still most of it's run. Things are changing though. COVID has definitely had people even rethink traditional pharma trials. But you would have, man, maybe 50, 100 hospitals around the country, part of the trial. Each hospital would have doctors and staff who would then put out local requests trying to look for patients within driving distance who'd come in and be a part of the trial, get their medication, fill out pen and paper. So it was a lot of pen and paper, manual entry, very heavy um, on personnel. And this whole notion of kind of direct to consumer studies is this idea that, well, what if I can just mail you the product? What if I can just collect information from you directly? After all, you know your body the best. You know your levels of, anxiety the best. You know your levels of sleep the best. You know your levels of pain the best. And luckily, there's lots of validated survey instruments that you can ask people. So it's not just saying, on a scale of 1 to 5, how's your sleep? No, no, no. These are like validated survey instruments that ask about sleep in very specific ways that are kind of benchmarked to actual sleep outcomes that you might measure and say by a doctor or with a sleep study. And so uh, this is why this model is actually quite not only quite feasible, but it actually makes a lot of sense for things like pain, sleep, anxiety, where the best way of tracking these conditions is patient-reported outcomes. There's not good blood tests for pain or MRI scans for anxiety or anything like that. Now, as far as the technology goes, we're actually still experimenting with a variety of different formats. And that's because another thing that clinical trials haven't really focused on is like user engagement, user satisfaction, none of this stuff. It's been generally a pretty kind of boring uh, and often annoying experience for participants. And at the end of the study, almost always they do not get their data back. So, you spend all this time in a study, whether it's an academic study or a pharma study, and you're like, wait a minute, what did you actually give me? Then they go, well, sorry, we can't tell you that. And you're like, wait, but you've been tracking me all this time. Like, how did my body change? And they go, we're not, we can't tell you that. Uh, and you made me drive through traffic every week to like this hospital to get stuff. So it's again, it's an unpleasant experience. And it's no surprise that only low single digit percentages of Americans ever participate in a research study. Right? It's pretty shocking considering those results are intended to then extrapolate to the 90+% of the population that didn't participate. So that's to say, we're playing around all the time with different types of engagement. So the app is certainly one method that we collect data, but also we're finding pretty good engagement off of text messages. You'd be amazed how people respond to text messages. I guess maybe we have way too many apps that give us way too many notifications, but hey, when you get a text, you check it and you answer quickly. So there's a variety of different formats: email, text, app-based notifications. I don't know in the long run where we'll land on which one's the predominant. I actually think we're going to offer all of them as options, and so each person can kind of decide what works for them. So this is not about, there might be some older folks who, for them, uh, downloading an app, remembering your password for the iTunes store or the Google store, that might be tough. Or even having a smartphone that can run an app sufficiently. So text message, email might be good for those folks in those situations.
That's very interesting. And one of the other things that I think of when I think of home studies versus going into a doctor's office or going into, say, a hospital, have tests run, I always think about my husband because, when he goes in for physicals or doctor's appointments, his blood pressure and his anxiety go up just because he's uncomfortable in the doctor's office. He just doesn't like doctor's offices. And so I would assume that maybe at home you even get more valid information than you would say in one of those clinical environments because of, a lot of people are like my husband, and those environments do kind of intimidate them and might even alter, how they're feeling at that moment. So that's fascinating that's the approach that you're taking. And I'm definitely anxious to hear what were some of the results that you saw from this first phase in the data that you've gathered.
Sure. Yeah, and actually, to answer your point, that's another big criticism. So not only have, clinical trials traditionally been, white males that live within driving distance of a major academic center in a metropolitan city, but furthermore, people react very differently when they're in a doctor's office. Someone has, a clipboard and pen and paper going through a list of survey questions. So just it's night and day. And again, it's no surprise that, and this is not, I'm not making this up. It's no surprise that sometimes, more often than not, pharmaceutical drugs do not work, or just treatments in general do not work for the indications that they were FDA approved for sometimes a majority of people that use them. That's because they weren't really represented in the research. So you're seeing this push towards real world evidence, real world data. And part of that is this notion that, well, heck, patient reported outcomes might be as reliable, if not more reliable, than data that a study coordinator collects or that a physician collects because of that artificial environment. Um, so it's very, yeah, very prescient what you just mentioned. In terms of what we found in the study, so here's many interesting things. Well, we'll start with first the fact that, and this is just phase one of the analysis. We'll be releasing phase two of the analysis in the fall, which also tries to dive into a lot of the personalized differences, whether it's user behavior, the time of day you took, for example, or user characteristics. What's your ethnicity? What's your starting baseline of, for instance, severity of anxiety? Because depending on where you start, you might see different total magnitudes of changes. That's another important kind of personalized factor that people might want to know about. But in this phase one of analysis, kind of one of the key things we found was that anxiety severity decreased significantly over the duration of the study compared to the waitlist control arm that did not use CBD. And the metric that we use was something called GAD-7, which is a highly, highly validated, kind of like the gold standard actually for tracking symptoms of anxiety. And what was, and again, especially in this era, now we are coming out of the COVID pandemic, but I wouldn't be surprised if across the board, anxiety has been spiking around the country. In fact, I think that's actually what's been documented, mental health conditions in general. So I think that's also a very timely insight. Now, some other interesting areas that we looked at, so there were several different products, 8 to be exact, that were studied. And they differed in dosage, they differed in form factors. Some were capsules versus oils. And they also differed in formulation. Some were using broad spectrum, some were using full spectrum. And the reason kind of those characteristics were chosen in kind of collaboration with Ray was, what are all these assumptions that you hear about in the industry that no one's really had data to prove or disprove? And those assumptions related to, no, oils are better than capsules. This is the dose you need. Anything higher, higher is not necessary, or this is a low dose you need, more or less. There were assumptions around full spectrum versus broad spectrum and all these things. So we said, all right, let's put it to the test. And what we found, again, in this first phase of analysis, was that the form factor didn't make a significant difference. So whether it was capsules or oils, we saw similar improvements in anxiety. We also found that the dosage, whether you were taking the lower doses or the higher doses, didn't seem to impact people's results. And also, we found that, at least in this case, the presence of THC uh, didn't make a difference. Now, what I'm going to caveat all of this with is that, yes, while these were 8 different products, they still represent a small sliver of the universe of thousands of different products out there. And what we considered high and low dose in our study, it's just a definition we used in our study. There might be people using doses 2, 3x higher than what we call the high dose. We don't know if that will create a significant difference. But again, this is kind of the first data that's ever existed to try to prove or disprove all these assumptions that the industry has. And so, look, a lot more research is needed, but this is really exciting because it's the first ever objective data you can sink your teeth into. And so that's why we're just honored to have been involved. And again, it's so exciting to see companies stepping up to actually generate real evidence, and investigate some of these things that academia should be doing, but they can't. It's not their fault. Their hands are just kind of tied right now.
Right. Yeah, and I agree completely. I am so thrilled, I think, to see some of this research being done. I'm thrilled to see companies like Ray stepping up and saying, hey, you know what, we do need to research this. We need to partner with somebody that can actually provide the qualified data that we need in order to consume, or in order to educate consumers the way that they need to be educated. Obviously, I think we all want to make informed decisions on things that we're putting into our body. And so I agree with you completely. This research is so necessary. And as you say, there's obviously a lot more to be done, which is a great segue into my next question for Angie. We've been talking about this as phase one. Do you have new other phases in the works with Radicle Science, and what kinds of things are you planning on looking at?
So as it pertains to this study, this is phase one. The full white paper will be released with a depth of data that we are working through later this year. And I think for us, kind of stepping back, when we started this company, I couldn't believe that not just for CBD, but for the supplement space more broadly, research, clinicals, you name it, was foundationally focused on what I like to call mice and men for the last few decades, if not longer. And so thinking about who we are serving, women are an underrepresented piece of that puzzle constantly, consistently. And so as we think forward, nothing to announce or describe for you today, but I think that's what's top of mind for us. And I think there's a number of ways to get that. And I think there's a number of ways to step up for well-being with, for underrepresented groups, women being one of them. And so for us, it's a critical point in the journey, and a lot more to think through of how to step up in the well-being space more broadly in the future.
Definitely. Yeah. And, as a woman myself, and talking to other women in the industry and just in life in general, it really is a shame how, and Paylene, I think, oops, sorry, that'll show up on my mic. I think Paylene kind of summed it up in a quote in the media packet that you guys sent over, and she talked about most research on the neurological effects of CBD have been conducted among men. And women have historically been and continue to be underrepresented as subjects in medical research. And I think that's why women have so much difficulty finding good quality healthcare these days, because of the fact that maybe we weren't represented appropriately in a lot of these conditions. Or Dr. Chen, you talked about how drugs are being prescribed for conditions that they weren't necessarily researched for. And so those drugs may not be the right thing to help, certain people with certain things. I know for myself, I can speak from experience and say, antidepressants and anti-anxiety medications, the side effects were far worse for me than the depression and the anxiety. And so for me, it was a relief to discover cannabis and hemp and CBD and cannabinoid supplementation, just because I felt like it worked so much better for me than pharmaceuticals did, or things that I tried in the past for anxiety. So it's thrilling for me to see this kind of research being done. And, Dr. Chen, just touch base quickly for me on your perspective, just how vitally important is this kind of research for cannabinoid efficacy, I guess.
Yeah, totally. And one of our kind of goals is, and again, this is me kind of invoking the spirit of Paylene, my co-founder, who is all about data. One of our goals is, rather than trying to just say, hey, CBD works for blank, what we really want to get to is CBD at this dose, used in this fashion, for this condition, in this type of a person, of these characteristics, is highly likely to work. That's the world that we want to get to. And it kind of always flabbergasted me that when I sit down to watch Netflix, that algorithm is literally using hundreds, probably thousands, maybe tens of thousands of data points about me to serve me entertainment. But when my mother goes to see her doctor, he decides it's time for a colonoscopy to give her anesthesia and give her an invasive procedure that has risks based on her age. It's like one crude metric. So we want to get to a point where we can have not just objective health data, rigorous objective health data on these products, but also personalized and precise. So who, when should use what and how. Like that's where we really want to get to. And it's a push that we're doing in the little microcosm that we can control, which is initially CBD, eventually cannabis, eventually natural health products. But this is a movement that the entire health space needs to move towards, whether it's helping you understand what types of food or what types of fitness regimens or other treatments. And yes, even pharmaceuticals, they have a role too. It's just when should they be used and when should they not be used? This is an entire push that we need to get to. And I hope things start moving in that direction, because you're seeing that move everywhere else, in marketing and sales and fintech and all of this. It's really time for healthcare to catch up.
Couldn't have said it better myself. Just over the last several years, being involved in the medical system with my husband's chronic pain issues and things, it's really just kind of amazed me how, like you said, it's still just kind of a guessing game, I think, for a lot of physicians. And I think if we can start to aggregate that data and really start to look at people individually, it's going to make such a difference in how we work with people on a medical, on their healthcare and keeping them healthy. And like you said, you don't have to do all these horribly invasive procedures and go on, all of these. One of my big problems right now with the healthcare system is the overprescribing, the one drug on top of the other, on top of the other, on top of the other. And I think there's just a better way. I think there's a better way really to discover which drugs are really going to work and which drugs are not going to produce the side effects, and then being able to give people those options. And I think that's the biggest thing I'm looking forward to with research like this, is that I think it's going to bring cannabis and hemp into, the future and make it become one of those options that people have when they're talking about their own health care. So Angie, touch base for me real quick as we're kind of closing things down here for the podcast today. But talk to me about if someone in our audience is wanting to touch base with you or someone from Ray, maybe talk about your process of deciding how to do this research or deciding to partner with Radicle Science. How can they get in touch with you or someone from Ray to have that conversation?
What I would say is we have so much great information on our website, so I'm going to keep it really simple. The best way is to visit us at our site at Ray Wellness, RAE wellness.co, and check out what we've done, check out the process, check out how we thought about the why, the what, and the how. It's all available and linked, via a white paper. And so I think the best place is to start there. And we've got contacts for both Radicle and for Ray as you kind of click through that information.
Fantastic. And Dr. Chen, same thing, same question for you. Obviously, at Cannabis Tech, we have lots of cannabis producers and entrepreneurs and people in the industry and in the hemp industry as well. How can they get in touch with Radicle Science if this is something that they're wanting to check into as well for their products?
Yeah, so you can, again, our website's probably the best place. It's radiclescience.com, and Radicle is spelled with a CLE at the end, kind of like particle, and it actually means the first root of a plant. And we thought it was a nice throwback to kind of our core kind of mission of studying all these natural health products. And on our website, you can schedule a free kind of 15-minute strategy consultation where we'll talk to you and we'll say, hey, whether a study does or doesn't make sense for you, and if so, which type of different studies. They all have different costs, different values, different times to complete. And so we're always wanting to ensure that, you're not getting you're not necessarily, getting a study that is maybe a bit too over your head right now. And there's ways to start small and give you some signal and give you some traction before you start considering some of the larger, more complicated studies that we can do. So yeah, that's the best way to get in touch with us.
Fantastic, guys. It has been such a joy to have you on the show today and to talk about this science, because as we've talked throughout here, I really do feel like it's these kinds of studies and this kind of research that's really going to help push cannabinoids into kind of more of a mainstream. I've kind of always had this vision that someday we can walk into CVS and we'll have a display of different cannabinoid supplements there that we can choose from, based on what our needs are or what kind of goals we're trying to achieve with our health. And I think this kind of research is just that next step. I really feel like it's really what's going to help get these products out into the consumer's hands and do it safely. So kudos to both of you on this partnership. It's fantastic to see this research finally getting done the way that it needs to be done. And thank you again for taking your time out this morning to join me on A Tech Moment.